Garrett and I will be investigating the racial and gender bias in pain management. We are interested in investigating college students' biases in pain determination and pain management decisions for white and black, female and male patients. As you can see, here are some news articles headlines outlining some issues involving biases in healthcare and the treatment that different patients receive. We want to investigate if these biases are held by students at the University of San Diego and consider how these biases could impact future provision of care. It is important to be aware of different biases, whether conscious or unconscious, that people might hold, as these can further intensify the disparities in healthcare. There is a lot of research indicating that race and gender impact the quality of care that patients receive. Research by Hoffman, Trewalter, Axt, and Oliver indicated that lay people, as well as medical students and residents, suggest that black and white people biologically experience pain differently, such as believing that black people's blood coagulates faster than white people's blood. This leads to black and white patients receiving different treatments for the same conditions, often with black patients receiving less pain medication or medical intervention. This study indicated that participants who held false beliefs about biological differences between black and white people rated the black patient's pain as less intense, thus influencing the treatment decisions following. In regards to gender biases, a study by Samolowitz, Gremir, Erickson, and Hensing found that women were often represented in literature as more emotional and hysterical when in pain compared to men who were described as stoic. This feeds into the stereotype that women are overdramatic, which leads them to often be dismissed or receive less treatment when seeking medical care. Another study also showed that residents are less likely to correctly perform key elements of a cardiac physical exam on female patients than compared to male patients. This evidence of differential care is important to consider as it impacts the health and well-being of a large amount of people. In our study, we want to see what general perceptions about pain tolerances are and how certain stereotypes impact them. We know that biases have been studied among those in the medical field, but we also want to investigate if these biases are held by students at the University of San Diego and consider how these biases could impact future provision of care, as some students could be future healthcare workers. We want to investigate how gender and race interact to form further biases for pain management. We hypothesize that the black female patient in the scenario will be offered the least amount of pain management or intervention and will have the lowest perceived pain score due to participants' racial and gender biases in understanding pain. As I mentioned before, past studies show that black patients and female patients receive less pain medication, so we anticipate that these two identities will interact and create further inequities in pain management. Garrett will now explain our different independent and dependent variables, as well as our cover story and procedure.
The two independent variables that we are manipulating in our study are race and gender. We will be giving our participants a vignette to read that explicitly states the gender and race of the patient. The vignette will be stated like this. Please consider the following scenario. A doctor is taking care of Daniel, a white male patient who is 35 years old and in good health. The patient complains of constant neck pain that has lasted for around 6 months. He says the pain began when he was carrying a heavy bag on his shoulder one day. The pain he describes is shooting pain from the neck into the shoulder, and it impacts his range of motion in daily activities. His blood work and scans come back clear, so no other health conditions are noted. The doctor interacted with Daniel for about 10 minutes and completed a physical exam. Daniel waited to be seen at the doctor's office for approximately 30 minutes, as it was a busy day for the office. We will be randomly assigning 4 different versions of this vignette to our participants. The one that I stated is with the patient who is a white male, but in the other 3, the patient will be either a black male, a white female, or a black female. We also included the names of the patients that should reinforce their race and gender. The white male is Daniel, the black male is Andre, the white female is Emily, and the black female is Aaliyah. These names may be rather stereotypical, but we want to make sure that the participants are paying attention to race and gender. The first dependent variable that we will be measuring in this study is biases in pain perception. We are including 2 questions to measure this. The first one asks participants to rank what they believe the patient's pain level to be on a scale from 1 to 10, with 1 being virtually no pain and 10 being the greatest amount of pain. We are using this scale so we can more efficiently examine how differently pain is perceived when the race and gender of the patient is manipulated. The second part asks 5 questions that aims for describing the nature of the pain that the patient is experiencing, and including questions like, how likely is it that the patient's pain is psychological, and how likely is it that the patient's exaggerating their pain for medication? They will respond on a 5-point scale ranging from very unlikely to very likely. We want to see how the level of pain corresponds to the nature of the pain. Our other dependent variable measures biases in pain management and treatment. We will ask participants to indicate whether a list of 5 treatment options are either appropriate or not appropriate for the doctor to recommend to the patient. These treatments include general pain medication, physical therapy, psychological evaluation, further testing, or no medical intervention. This will also help us understand what the participants think the nature of the pain being experienced is. The different treatment options presented help indicate how serious the pain is perceived to be, with no medical intervention meaning it might not be that serious, and further testing meaning it could be a lot more serious. Our cover story will tell participants that we are interested in seeing the way situational variables affect perception in a doctor-patient setting. We will indicate that we will be providing descriptive information about the patient to help the participant better picture the scenario. Participants will read the cover story first when they begin our study, and right after they will be randomly assigned one of the 4 vignettes. After they read the vignette, they will complete the 10-point scale indicating how much pain they believe the patient is in, as well as the questions about the nature of the pain. After they respond to those, they will indicate whether or not the different treatment options are appropriate. Once they have completed everything, we will debrief the participants, letting them know that we are measuring racial and gender differences in pain perception and treatment, and we will thank them for taking the time to participate in our study.